Hello, everyone. Thank you for joining us today. We are so excited for this last presentation today, Living Donation, a Testament to Hope and Resilience. Today we have joining us Anne Halpin, who is PhD and currently appointed as an assistant professor in the Department of Laboratory Medicine and Pathology in the Faculty of Medicine and Dentistry. She also works in the West Research Group's Cardiac Transplantation Lab in the Department of Pediatrics, Surgery, and Immunology at the University of Alberta. She has worked for several years in the human leukocyte antigen field and is also an assistant clinical professor in the Department of Laboratory Medicine and Pathology. Her areas of interest include histocompatibility, ABO histocompatibility, transplantation, and living donation. And you can catch one of her other presentations to us on our YouTube channel. And then next, it is my pleasure to introduce Dr. Kelley Hitchman, who holds a PhD in immunology and is an associate professor in departments of pathology and laboratory medicine and the Alvarez Transplant Center at the University of Texas in San Antonio. She is the section chief director and clinical consulting scientist of the Histocompatibility and Immunogenetics Lab at University Health of San Antonio, Texas. She's been honored to serve on several transplant-related boards of directors in the United States and has chaired and volunteered on multiple transplant community committees. Dr. Hitchman is published research and clinical scientist and is co-host of the monthly ASHI podcast, Coffee and Compatibility. I love that. She became a non-directed kidney donor in 2021 and since has become a passionate living donation advocate and educator, supporting many initiatives to dispel myths surrounding the post-donation quality of life for living kidney donors. And with that, it is my pleasure to hand it over to Dr. Kelley Hitchman.
Thank you so much, Melissa. As I pull up my slides here, I just want to say thank you so much to the organizers for inviting us and especially for inviting me to share the stage with Dr. Halpin, who is a fierce living donation and HLA warrior. It is an honor and an even bigger honor not to just be part of this conference for a population of patients that's so very important to my service in San Antonio and Anne's as well. But during pediatric week. So it's lab week, it's donate life month, it's the pediatric transplant week. It couldn't get better than that. So I'm going to dive right in and talk about my story in living donation and how it's really changed my outlook, not just on donation, but on life. And even in a professional sense, it wasn't always easy. And it's certainly not easy, I'm sure, being on the other side of this equation. But it's doable. It's absolutely doable. So this is really cheesy, but I feel like the time moves forward and we forget the details of what happened. So wanted to share with you guys literally what was going through my head the morning that I walked into the hospital to give one of my kidneys away to a person that I didn't know. This is literally a recording of me as we were getting ready to go to the hospital. It's like 5 o'clock in the morning. You're not supposed to wear makeup. I look terrible. And this is it.
It's July 22nd, 2021. And this is the day that my donor journey begins. I am ready. I'm about to head to University Hospital to donate my kidney and start a 3-pair chain of donation. I've been waiting for this day for a long time, and I'm very, very excited. Let's see where Boo is. Boo's probably excited too to have it over with. There's Boo. There's Boo.
Husband could not be more over it at this point. Could not be.
There's the baby. The baby. Stayed in our room last night. There he is. He's so helpful. The beginning.
So for me, this was definitely a beginning. I was thrilled. I was curious. A lot of nervous energy for sure. So I get the question a lot, like why? Like why in the world would you do something like this? And obviously, as you can see from the slide, it is not a not messy decision. A lot of factors go into this decision. I made my decision during COVID. So I donated during COVID, and for me, there were several things that really pushed me over the fence to doing something that I had thought about doing for a long time. I had fantastic support from my close friends and from my HLA community. That was amazing. I had great trust in the facility that I was at. I had watched our facility work for years. I knew that I would never feel more comfortable donating anywhere else and that it was time for me. And there was a lot of social unrest and social injustice in the moment. And all of those things together with COVID really put our patients in a difficult position. They're already in a difficult position. But I couldn't stand by knowing that I could probably do something about that personally any longer, seeing how much suffering and additional hardship they were undergoing. And in our population in South Central Texas, our patients are very largely in a Hispanic population, and those patients were experiencing disparity on the wait list. So I didn't want to just donate a kidney. I wanted my kidney to stay in my community, and I wanted my kidney to go to a Hispanic recipient. Specifically, I wanted to donate to a Hispanic parent. Because not only is there a disparity gap there, there's also this issue of parenting. I could barely keep up with my two kids with two kidneys. I can't imagine having to keep up with children, be on dialysis, work, provide for your family and feel like a regular human being. I wanted somebody to have all of the blessed privilege and chances that I am so fortunate to experience. So all of those things went into my decision. And I had the best support in the world. I'll say my parents were not at all originally supportive of my decision. I just kind of had to be my stubborn self and say, thank you very much for that opinion, but this is what I've decided to do. It couldn't be more opposite for my friends, my husband, who was terrified. I'm a pretty healthy person. My husband was terrified. But he knew that I was going to do it regardless, and he was very supportive anyway. And I had this great team. Top center are all the nurse coordinators on our living donation team. The gal in the Texas A&M face mask, that is my living donor coordinator and good friend, Luisa Gonzalez. Top right of your screen is my fantastic surgeon, Elizabeth Thomas, who has these beautiful small hands. So my scar is very small. And you can kind of see what we were going for there. I was so fortunate to help more than one person. If I stepped into this situation without a recipient in mind, I just knew I wanted to donate to someone. Then I could step into a situation where there was a pair that couldn't direct donate and help that person, but then their donor could go on and help somebody else, and their donor was able to go on and help someone from the list. So when we did this surgery that day, we were able to get 3 people out of the need for transplant, 2 parents and one child. So it was a good day for all of us. And I want to introduce you to this just outstanding, brave soul who I did not know at the time. This is Joel. Joel was on dialysis for about 5.5 years, which really increased his likelihood of passing. The survival rate on dialysis is not so great, and he was on dialysis for a long time. This sweet human went through so much. He has been through eyesight issues. He's lost 80% of his sight in one eye due to his diabetes. He had to have an amputation because of his diabetes. He lost his career in firefighting. because of his diabetes. And of course, it significantly impacted his family and his ability to feel like he could care for his family. So he suffered with this all this time until he was really struggling on dialysis, and he pleaded with his friends and family for help. And this beautiful young lady, who is Joel's niece, came forward on his behalf. And unfortunately, she and Joel were not directly compatible for each other. It wasn't a good kidney for him. His body likely would have rejected it. So then, the situation is kind of up in the air. You have somebody who's willing to do this for you, but the situation can't move forward. So what happens then? Well, then, by the grace of the cosmos, Joel and I didn't know it, but we were meant for each other. I like to think that this whole time I was just hanging on to Joel's kidney until it was time for him to need it, and it was time. So I donated, and about a year later, I got to see and learn about the person who had my kidney, and I was very surprised to see that it was a gentleman, and a gentleman much larger in stature than myself, and that he was doing great. He gained a healthy amount of weight after the kidney. He was able to eat. He was able to go on vacation. I never took the kidney on vacation, so the kidney is definitely happier where it is now. And now Joel and his family and I are good friends, and we see each other as often as we absolutely can. And our lives post-donation and post-transplant are great. These are all pictures on the left of Joel and his beautiful family enjoying life to the fullest. They go on vacations. He's able to root and give all of his energy to his 49ers during football season. And he and his wife even went on a trip to Las Vegas, which they'd never gotten to do. And as you can see, like, I have tons of time to pursue hobbies. I climbed a couple mountains about a year ago. There's been no slowdown in my life. Anne and I have similar professions. We could say it's quite the opposite of slowing down. It never really does that. So there was no drawback for me. My healing was a pretty boring process. Within a few days of the surgery, I didn't need any pain medication. Within a week, I could walk 4 miles. And if I didn't advocate for living donation today, I'd have forgotten that I even did it. That's how normal my life is. But we don't stop. I really didn't have any intention of doing anything but donating and then hiding back in my office for the rest of forever. But my nurse coordinator, encouraged me to share my story and to advocate. And when we do this, we don't do it small. So that's what we do. Joel and I go out together. Joel's a fantastic advocate and educator about diabetes and trying to prevent diabetes, but also about the transplantation process. I co-founded a chapter of Donate Life America's We Encourage Living Donation to help educate about living donation in my community with my good friend and fellow living kidney donor, Becky Bustamante. And there are some pictures of our group toward the right-hand side of the screen. And I got this amazing life-changing opportunity to go with a group called Kidney Donor Athletes and climb Mount Kilimanjaro with about 11 other kidney donors, just to hammer home the point that there's a myth out there that you can't have a full quality of life, or that you're physically restricted after kidney donation. And so our goal was to prove that that's a myth and do it in one of the biggest ways possible. And we did it. We summited on World Kidney Day in March of 2024. So things go on. But this is my story, and this is my side, and I do express to you that side with a lot of advantages and a lot of privilege that a lot of people don't have. Certainly have never had to go through the side of this process where I'm on dialysis and I'm struggling with a disease, and I have to deal with all of that and live my life. Certainly not from the context of being a parent of a child who has to go through that, be it a kidney or a liver, just as much struggle. This, I imagine, can feel like climbing a mountain, and finding a donor can absolutely feel very difficult. I would say, please put out the call to find a living donor for your child. If your child is in need of a kidney or a liver, put out the call. I promise you, you are not putting your donor at risk. You can run and play sports. You can share an adult beverage. You do not have to take medications for the rest of your life. You will be able to have children in the future, and it will not shorten your life expectancy. I have not experienced any of those things. And if people have questions for you about this and they say, oh, I don't know, like, is it safe? Absolutely. And there are more and more studies out there all the time about the quality of life and the safety of living donation. We're working on some of those studies here at my center as well. But you don't have to take it from me. You can take it from the scientific literature as well. It's a perfectly safe process. There are folks out there like myself, like Dr. Halpin, that are waiting to hear a story, that are waiting to hear about need that gets them off the fence and into a donation situation. There are so many ways to reach those people. Social media is a powerful and accessible tool for many people, but please don't discount grassroots movements, your church, your neighborhood, your community, your personal support groups, local lists, national lists. Build your support network. And if you have people that aren't comfortable with donation, that's fine. They can be a champion for you and bring your story to their circles as well. Things that I hear from donors all the time just impart to you the passion that donors have and how life enriching the process of donation is. I've said a lot of these things. I would do it again. If I could do it again, I would do it again. Some people go on to donate another organ. If they've donated a kidney, they go to donate a liver. If they've donated a liver, they go to donate a kidney. It happens. I had such a great experience. I wish I could describe to you the euphoria or the joy that I feel from having had this experience of being a donor. I wish I could do more to help. I just real quick in the end here want to show you there are lots of resources for living donation, maybe even so many that it's overwhelming. NALDAC here in the United States is available for living donor assistance. This is financial assistance based on the household income of the recipient, not the donor. This can reimburse costs associated with the workup and with the donation process for missing work, needing dependent care, transportation, lodging, all of those kinds of things. The National Kidney Registry and the Alliance for Paired Donation are national programs here in the US for living kidney donation that have a lot of resources on their websites and that provide voucher programs. A big question for a lot of people is, well, I would donate, but what if my child needs a kidney someday? What if my husband needs a kidney someday? What if my parent needs a kidney someday? Voucher programs are meant to try to address that so that you can donate your kidney in exchange for a kidney for your loved one down the road. Donate Life America has wonderful resources for living donation and transplantation in general. The United Network of Organ Sharing and the OPTN have resources. And I love this group in New York that has been so successful in supporting and growing a community of living donation called Renewal. They are a very grassroots movement in New York, and they have kind of made it so that if you're part of the Jewish community in New York, you'll get a living donor kidney almost without question. They have really built a community grassroots movement around living kidney donation. So I want to thank you so much for giving me this time to share my story today and to encourage you not to fear the big ask. If you are in need of a transplant, or if you're a parent in need of a transplant for your child, ask the ask. People want to hear the ask and don't feel bad about it. Thank you so much.
Thanks, Kelly. That's a tough act to follow. Do you want me to do mine and then do joint questions, Melissa, or how do you want to handle the questions?
That's perfect. Let's do that. And then we'll answer all the questions at the end. Thank you so much, Kelly.
Okay. I know, the fantastic Dr. Kelley Hitchman. So there's definitely some overlap between the messaging that we'll share today. I did not climb a mountain. That's one thing I will not overlap with Kelley, but I'm going to talk about some of the things that I've done post donation and kind of what brought me here and some of my musings now after the fact. So my donation story began a little bit differently. In the sense, and I've seen many happy donation outcomes and transplantation outcomes for many years, but this gentleman on this slide here, who I had the pleasure of actually seeing earlier today at another local meeting, Sean Delaney, was worked in transplantation here and still works in transplantation here in Alberta. Needed a second transplant. He had some antibodies. He was a bit hard to match. But he had so many people step forward for him. So I was watching that and I knew I couldn't donate to him because I already knew my HLA typing. So that's an unusual thing about being an HLA donor or an HLA person who works who thinks about being a donor. But so I didn't step forward initially, but I watched him have many people be worked up as donors and not proceed for one reason or another. And so I listened to him at this 2019 Canadian transplant meeting, and I thought, you know what, I need to step up here for this friend. And so the other thing at this meeting, so this is a little snapshot from one of our HLA conferences. So this is on the dance floor of the HLA conference, and so Dory Tsagev, who is an amazing transplant kidney urologist surgeon, who also happens to be our DJ at these meetings. You can see we work very hard, but we also like to have a little fun when we get together with our wonderful HLA family. And he gave a talk at meeting talking about the outcomes of living donation, as Kelley said, and how safe it can be. And I looked at this graph of outcomes of living donors, and I was like, there is absolutely no reason I shouldn't do this. And so I started, and I started immediately before COVID started. So that was a little bit of a hiccup for me in my timeline. So the picture of me sitting and waiting to get my blood taken. There is a lot of testing. One of the reasons it's safe to be a living donor is because they test everything. They test all the things. There's lots of blood work, x-rays, CTs, ECGs. In my case, I had to have a pulmonary function test because of something that turned out to be nothing, but they're just so careful with living donors to make sure that they leave no stone unturned. I had discussions with my family. My children are a little older than Kelley's, because I'm a little older than Kelley. But so they were in their teens, and I wanted to make sure that they didn't have a concern about what I was doing, and that if they did, could we talk through it? And then for me, just all along the stage, worry can pop up because you're having so many tests that you do worry. Both my sisters have already had to deal with cancer, and I was like, well, is this when we find out about my cancer? Because they're looking at literally every nook and cranny of my body here right now. And for me, I was very lucky that I went through all these tests and everything was fine for me. It did make me laugh though, because of COVID interruptions and other things, they have to test you for transmissible diseases every set number of months, and mine kept timing out because of an interruption of here or there, and so they tested me for syphilis 3 times, and I said, I promise, I'm just not that fun. But anyways, these are all good rules that they have. They test you for everything. And so I'm working along, and I'm going to be in this kidney paired exchange program that Kelley already discussed. But then my friend Sean actually had after literally dozens of people stepping up to be potential donors for him, he had a friend of a friend come forward and donate to him. And so he phoned me and he said, oh, Anne, you are off the hook. I want to thank you for, offering to do this, but, I have this amazing donor now. And so, I watched, this is, they have their permission here to put both their pictures up, and this is them right after their donation, nephrectomy and transplant surgery. And, it really went awesome. And I just was so delighted to watch him get his whole life back. He also hikes and walks and lives his best post-transplant life. But, I felt like I'd made this big decision, and I wasn't ready to abandon this decision that I had made, but I also wasn't sure how much it mattered to me to be connected to my recipient. How much did that matter? Because, I got to watch someone get better. And if I donated as an anonymous or undirected or altruistic donor, whichever word you want to use for that, I wouldn't see that part. And in the end, I decided that didn't actually matter to me. And so I proceeded on the, we have in Canada called a kidney paired exchange program. It's a national paired exchange program where it's very, very similar to Kelley's experience. You choose to be a donor. You're not attached to a particular recipient, and they create a chain of donor recipient pairs. And so I moved ahead. Is still, as you can tell from masks here, and I know Kelly had some of the same thing, is still sort of in COVID era here. And there's some other unexpected things that happen in your donation journey. Sometimes I was all booked, the surgery was booked, everything was going to proceed, and I'm walking on the trail for one last post donation surgery, like long walk in my favorite trail before my recovery would be happening. And they got this phone call at 7 p.m. saying it's canceled for tomorrow. And I was like, oh. And I was so disappointed. I could only even imagine how disappointed the recipient was. They had something unusual pop up on their admission testing, and it turned out to be fine. And we did get rescheduled with the same pair. We didn't have to rebuild that chain, but it was these are things that happen, and you have to be mentally prepared for that. I was very lucky. I had some flexibility in my timing with my employer. And also, one thing I want to mention, my employer is a member of something called the Living Donor Circle of Excellence. And if you're not familiar with that, this is an American Society of Transplantation, Canadian Society of Transplantation initiative where employers who sign on to do this say, I will pay a living donor, living kidney, living liver. I will pay the employers will pay their salary while they're recovering. So you do not have an interruption in your salary. So I was very, very lucky that that was the case for me. And my recovery, much like Kelly's, was very straightforward. I actually only spent one night in the hospital. I was very close to the hospital and I was doing well, so they let me go home. Normally you'd spend probably 2 or maybe 3, depending. And they're not going to kick you out. They're going to let you recover, obviously. And I was very happy to go home and eat my own food. That was the worst part of the hospital. was the food. I just recovered home. My dogs just know when you're like getting better or when you're recovering from something. She did not leave my side. You can see her looking up at me here in this picture. I was able to do a few things remotely from work, and I actually went back to work pretty quickly, but no one was rushing me, and that was on my own terms, and I had a very positive experience in my recovery. So post-donation, there are no changes to my daily life, except now I have a nephrologist or a kidney doctor. I do think about transplantation through a new lens. I've worked in the field of histocompatibility, the HLA side of life for decades, and so I'm not a stranger to transplantation, but it did change the way I think about it. And honestly, it just makes me happier. I think when we say altruistic donor, it's just the wrong term, because altruism implies there's no benefit to the person who's making the act. And that just isn't true. And Kelly spoke to this as well, that she's happier. It just made her life better. And this is a life enhancing decision for me. And I, personally feel just any day, if I'm having a bad day, I can just think about this and be like, wow, that's awesome. There's some things I think about, still now. And one difference between Canada and the US is it's much more challenging to be united with your recipient as an undirected or altruistic donor in Canada. So it's unlikely that I will meet the person that I donated to. And I'm okay with that. I do think about them, and I hope that they're doing well. And I also wonder, with my HLA hat on, I wonder how well matched we are. I wonder, what their long-term, outcome's going to be, and all those things. And I hope that their life is better. And I hope that, they're peeing up a storm somewhere. I do think about, how can I protect my renal health? I joke with my nephrologist, I'm going to live longer and have better renal health now because I actually drink more water now. So than I used to. I was a terrible, probably chronically dehydrated person pre-donation. I'm very grateful to have a nephrologist, but I do wonder, should there be more testing? Are we doing all the tests that we're doing that we could be doing for living donors? Are there going to be things that we learn in the future that we think, oh, I wish we'd been looking at this test. This should have been part of the workup, or this, should be part of the post-transplant or post-donation monitoring. And should the testing be tailored to individual donors? Do women need different testing than men? Do, younger people need different tests than older people? What don't we know yet? Because in medicine and in science, we're always learning. And specifically in Canada, because I live here in Canada, how can we better capture results of living donors to show and make more people feel comfortable to donate? There's literature out there, but is it, specific enough to my age, my sex and gender, to, where I live in the world, to my access to healthcare, to my all the factors. If we have national registries, why can't we be capturing in these registries more post donation information? And so if anyone listens here is, or this recording later is thinking like, I'd like to advocate, or I am a living donor, or my child received my kidney, or, whatever the case may be, these are things I think we can advocate for as donors. And I think it would serve us well in this field, because I actually think it might lead to more donors if we could show how safe it is and show the benefits of being a donor and show that we can do this without any negative consequence to us, or maybe learn things we need to do to make it more safe. And, are there ways that we can predict over time for me and other donors that our renal function will remain good? And just, again, that research in living donor outcomes. We research a lot in recipients, as we should, but I do think there could be more research done in living donation. And that's something I like to talk about to my colleagues. I can be a call from, within the side the house, or what is that in that horror movie? The call is coming from inside the house. I can like sit in rounds and say, you know what, I actually think you should test donors for this. And maybe they'll listen, maybe they won't, but I can say it. Other things I consider now, what support exists for donors, such as wage coverage, et cetera. And I mentioned the Living Donor Circle of Excellence already. In Canada, we have something called LODERP, which is a horrible sounding acronym, but it stands for Living Organ Donor Resource Program. Anyway, it's for living kidney and living and liver donors, and there is a support network that's national for that. That's probably the most extensive support network, and then there's some other smaller ones, not quite as many in Canada that I'm aware of that Kelly listed on her list, but there are some. And for me, I was very fortunate because my wage was covered, and also I literally work in the building where my workup was. And so I just walked down the hall. I didn't even have to pay for extra parking. I'm already here. That's very fortunate. I recognize that privilege that, sometimes living donors are having to travel to another city or place, or, take time off of work in a way that I did not have to for their workup examination. So things like single donor workup days would be amazing, I think, for, programs that don't already do that. As another sort of funny anecdote, my program here did offer, did I want to go somewhere else to do my donation, because I do work with this program and it's kind of an intimate process. And it does kind of make me laugh sometimes inside my head when I'm sitting in transplant rounds across from my surgeon. And you think, well, he sure knows a lot about me that the average person doesn't know. He's seen lots of my bits and pieces, but it didn't matter to me, and I was very happy to be here in this program that I trust in and knew, and I didn't want to travel, so that did not matter to me. They did offer that to me just in case that was an issue for me. And although my family was supportive, not all my friends were encouraging. And Kelly touched on this too, that, it doesn't feel good when you've made this big decision and someone's like, oh, I think this is a silly thing. I don't think you should do this. I think this is dangerous. Like, why are you doing this? Because it's a big decision. And once you make that decision, you want to be encouraged and not discouraged. And I think increased public awareness, which again could translate to more living donors, would be wonderful to know that this is a safe, thing to do. I'm still running, I'm still hiking, I'm still working, it's no difference for me in my life, but not everyone has that awareness. And some people have fear around it, and they not, that it didn't change my mind. And I hope it wouldn't change any living donor's mind, but that shouldn't be a barrier, I think, to living donation. And also the vouchers that Kelly touched on. This is not something that exists in Canada, but the NKR has these where, you can then sort of pay. I saw this question in the chat too, that you can sort of have this donate now and save your voucher, your donation forward a piece for later. This might be a safety net that people might want to use if they were concerned about donating, and then what if somebody else in their family needed a transplant later and now your spare is gone. This was an easy decision for me, especially, going through the last few years preceding that, and just seeing my friend Sean get his life back, seeing, other people make this decision, and knowing from my career in transplantation that this is an amazing, incredible thing that we can do. But, I think, again, more research, having a better prediction of donor risk specific to individuals would be great. And I think it might translate to more living donors as well, because we have neither Kelly or I said this, but I think everyone in this, where you are, knows that we have a shortage of donors. We need more donors. And maybe this is I shouldn't speak of it like a commodity, but maybe anonymous donors are an untapped market. So parting thoughts here, just for the ask. don't refrain from letting others know what you need about a kidney. And I can't speak to liver donation, but I hear the same thing from living liver donors that I have the privilege of knowing. This is a decision that the donor will make, and it is, when you put out that ask, you're simply stating a human need, and you're letting other people make the decision about what they want to do. That knowledge is totally, that knowledge, what they do with that knowledge is totally up to them. The decision is up to them. As a living donor, when you're worked up, you are told over and over and over, you can change your mind. You can change your mind. You see a psychologist, you see a social worker, they check to make sure you're not being coerced into anything. And at any time and point, you can, withdraw, and no one needs to know why you're withdrawing. It's just that, you weren't a suitable donor. And it is, I didn't have any concerns as I went through, but it would be normal to have that, or maybe medically you'll be declined. Maybe there'll be some small thing that where the transplant program is just not comfortable for you to proceed. And that's why that workup exists. It would have been very hard to talk me out of this once I decided. And so if you're asking someone and you're nervous and they want to do it and you're like, I don't want I don't think you should do it. You're talking them out of something potentially, that may actually really benefit their lives and make them feel like just happy, like I do and like Kelly does. And so, the wellness of the donor is also not the recipient's responsibility. It's the responsibility of the transplant program that's working up that donor. They decide if the donor is well enough to do it. They decide if the donor's health is sufficiently all there and there's no risk for the donor. That's their job. And they do it very well, and they take it very seriously. And then just as I've mentioned this already, but I don't think there is such a thing as an altruistic act as a living donor. I think we need different words than altruistic donor, because I just feel like it's benefited me too much to consider it an altruistic act. And I think that's my last slide. So I'll stop there. And thanks so much. As Kelly said, I'm delighted to be here. I think your organization is amazing. I got I had the opportunity to interact with you before, and I've been following what you do. And I think you're such an incredibly dedicated, caregiver-driven organization. I think we need more of you in this world. And I'm really, really honored to be here today. And I'm really just delighted that you asked me to speak on this topic.
Thank you so much, Anne. And I echo the many parents that we have with us today and have been with us all day. Thank you. Thank you both for being here and for answering these questions. We have a few extra questions for you if you're willing to take a few extra moments before we close out this amazing day. Let's see, over here, we had some good questions from Sarah. She said, we've been told that if a recipient is enrolled in Medicare at the time of transplant, then the living kidney donor can receive lifetime Medicare coverage for post-donation complications. Kelly, do you want to take that one?
Yeah, I would say that I have not heard that. Right now, as far as I'm aware, the guarantee for post-donation medical coverage is 2 years in the United States. So there's a 2-year follow-up period during that time, and only for donation-related care post-transplant. Post-donation, you are covered by your recipient's insurance, regardless of the type of insurance that is. If the insurance allowed them to get a transplant, the donor is coverable under the insurance for post-donation needs relative to the donation for that 2-year follow-up period. After that, from an insurance standpoint, no matter the need for the donor's health care, the donor is on their own. And I will say this is a big point of debate and contention in the US. There is something called the Living Donor Protection Act that was introduced in 2023. It has not passed yet, but there's a lot of chatter around about it. This is an act that would prevent all insurers from denying coverage to living donors for any reason post-donation. So I will say it is a potential fact in this country that an insurance company could deny care to a living donor outside of that 2-year period if they feel that's appropriate. Now, there are, of course, a lot of legal ways to dispute that. I have certainly never experienced that. I have needed medical care for non-transplant related reasons since my donation. I had a hysterectomy last year, like all those things. I have never been denied for care from my insurance company. But again, my story is my story, and I realize that other people's stories are different, and I do operate from a place of privilege. But that is the fact. So yeah, I'm going to put something in the chat for folks as a resource. This is a pretty up-to-date list of legislation going through in the United States related to living donation, all the acts that have been passed recently to protect living donors, to make sure they can get adequate time off of work for living donation. The Living Donor Protection Act is in there. And there's also, the thing I love about this resource, a state list of state-specific laws for living donation. So hopefully that is a benefit. That's a wonderful question. Thank you for asking.
We'll have those links when we repost on our YouTube as well. That was a wonderful answer. Plus, go visit the I'm going to say this wrong, and NELDAC booth that we have with us as well. They're in our lobby area for the exhibitors, and they have information that can help cover any extra expenses as well. I'm going to give one last question. This one might be a little tough one. It says, this was also positive, but I have heard some less than great things from people that need time off work, childcare, pain. Do organizations help enough? I've also heard people say that there need to be more protections, and you just addressed that.
Yeah, so again, I'll say that, my story is certainly my story, and is, slightly different, from Anne's story, is slightly different than so on and so forth. There are certainly people who experience more pain post-donation than I did, or that go back, that their scar herniates and they go back. There are certainly people who have not as positive an experience as I had. It is a surgical procedure, and there is risk associated with any surgical procedure. I think the point that I'd hope to get across to people today is that there's no more risk in this surgical procedure than most other, pretty common surgical procedures. And it's true that people can have complications post-living donation. They are just not common. As far as support, I have found great support, but that's part of the reason I chose to donate in my center, is because I knew I would find great support here. And they have treated me no different than they would treat any other living donor. I was not given special privileges or special treatment. And I could say that about a lot of centers. This is something for donors to ask when they go to inquire about living donation at a center. What is your policy on living donor follow-up? If I should have a complication 5 years after my donation, what would your center do about that? So I think there are ways for living donors to look out for themselves from the get-go, even before donation, and people should do that.
Yeah, it's a little different. Canadian healthcare is distributed a little differently. So it is not so much a question of coverage. However, it is a question of care. Like my family doctor is retiring. I was so grateful I was offered a nephrologist, but not every living donor program does offer you a nephrologist, like long-term coverage. And that meant a lot to me, because I know when they look at my blood work, they immediately know what they're looking for, because like any specialist, they have specialist knowledge. And so that is something that I think is a good question to ask, is who's taking care of me long term? What if I move? How are you going to help me? Is there something I can bring to my next caregiver so they don't freak out when they see my creatinine or my GFR? And like that's important, because the blood work doesn't look the same exactly after. Like I have 80% of my GFR function post donation, which is awesome. But and that's great, but that still doesn't look normal. So it's low. Like, so if you just looked at it and didn't know I was a donor, you'd think like, oh, this woman's going into renal failure, maybe. And it is important to understand that. And I think that is something to take forward. And I put a link in the chat for any Canadians listening. So that's that loader program that's in every province in Canada. And there's a few other resources here and there, but your transplant donation program also is a great resource for that. And they will for sure be able to give you additional resources that are maybe even some that are specific and local to you that that other people wouldn't be aware of as well.
Well, I want to thank you both again, Kelly and Anne. It's such a joy to have you with us every time. And for those watching, go watch Anne's other presentation with us. It's actually one of our most watched sessions of all time, Histic Compatibility. And she does an amazing job with this. And Kelly, it's such a joy to see you again. I can't think of a better way to end off this amazing day. Thank you both.
Thanks. It was a pleasure.
Thank you so much. Yeah, you're just doing such great work here. I'm really privileged to be here.
We feel the same. We hope to talk to you again in the future. To all our people watching, hang around for end of day closing, and that'll be a wrap. Thank you all.